start just like, how do I, I mean, it's a little, am I online already? I'm online? I'm good? Okay. All right, well, good evening to everyone. I'm very happy to be here in the Headache School. My name is Dan Kaufmann. I'm a research assistant professor at the Department of Neurology here at University of Utah. And the topic of what I want to talk about today is complementary interventions for migraine. And the outline of my talk, as I'm displaying it here, is I want to give a brief introduction about migraine, about the definition, classification, just so that I'll have some starting point to actually explain afterwards why is it that we need this other complementary interventions. So we're going to talk about migraine, the triggers, the pharmacotherapy, and the non-pharmacological management. And then I'm going to be talking about the two complementary interventions which have been shown to be very effective and efficacious in clinical trials for migraine, which mainly we're going to talk about biofeedback, but I also thought that I cannot talk about biofeedback alone without giving some explanation about relaxation techniques and self-hypnosis, which is also what I do. So we're going to talk about hypnotherapy and, of course, biofeedback. And if we're going to have time, I would like to add about our Healthy Mind group, which is another intervention that we're doing here in the University of Utah. So I'd like to start with the migraine classification. As we can see in here, and we're not going to look at all of the different classifications, but just in general, according to International Classification of Headache Disorders, the main classification that everybody knows is that we have migraine with aura and migraine without aura. Usually migraine with aura is about 20% of people with migraine, and this is broadly, when we talk about migraine, these are like the two main classification. And so just as a brief overview of what exactly is migraine. So migraine is considered as a chronic episodic disorder, which is characterized by episodic attacks of headaches, but also associated symptoms. Migraine is assumed to be affecting about 12% of the population, or about 12 to 18. Women are 3 times more prone to migraine than men. This is why about 17% of women versus about 6 to 7% of men. But migraine, importantly, in terms of the diagnostic criteria, has to fulfill some criteria, and that criteria is indicated in the slide, is that the headache attacks are usually between 4 to 72 hours. Sometimes it could take like 3 days. The headache needs to fulfill at least 2 of the following: unilateral location, has a pulsating quality, it can be aggravated or initiated by physical activity, and it usually is moderate to severe in intensity. And of course, during a headache, at least one of the following needs to occur, which is either nausea, vomiting, or both, and the occurrence of sensory abnormalities such as light sensitivity or photophobia, sound sensitivity or phonophobia, or maybe both, and sometimes even scent sensitivity, which is termed osmophobia. In terms of the migraine triggers, and the reason I'm talking about the trigger will be clear afterwards when I'm going to be talking about the complementary intervention. Usually there are a lot of triggers for migraines, but the main standard triggers that we mainly seeing in the clinic and are displayed in research that is published is usually diet, meaning hunger, or food, or some certain food additives. Sometimes hard cheese can trigger a migraine, coffee or coffee withdrawal, some types of chocolates, and usually when I talk to people with migraine, they're have all sorts of different food additives or different types of food that they identify that trigger their migraines. Hormonal, this is very important. In times of hormonal fluctuation, such as the time of the month, menstruation, menopause, or pregnancy, usually during those times there are changes in the frequency of migraines, either exacerbated or reduced. Environmental, which is also very important because sometimes we can't identify those triggers. So sometimes all sorts of visual stimuli or odors, or sometimes changes in air pressure. So when people move from one state to another, from one city to another, and there's differences between those cities in terms of how elevated those cities are, usually people experience changes in their migraine frequency. And also at the end, but again, very important, is the occurrence of stress, the occurrence of trauma, exertion, or anxiety. So migraine has been shown to be linked with both anxiety and depression. So the occurrence of stressful life events sometimes have been shown to exacerbate or initiate a migraine attack. Although interestingly enough, during a stressful time, usually people don't experience a migraine. People usually experience migraine after stress has already dissipated, which is also interesting when we're going to talk about the different complementary interventions. In terms of the pharmacological management for migraine, so we have the medications, we have the acute treatment, which is the symptomatic relief of the migraine, or the preventives. And for the acute treatment, we have the non-specific, over-the-counter medications such as acetaminophen or the NSAIDs, or the specific medications such as the triptanes or dihydroergotamines, or we have the preventive medications if the migraine frequency is substantial, such as the anticonvulsant, beta blocker, and so forth. And this is not a talk that is going to be covering all the specific pharmacological management. Again, it's just a very, very broad characterization of what is out there to treat migraines. But beside the pharmacological management, we have the non-pharmacological management of migraine, which is mainly starting a diary. Now, this is something that is important when people first, or when they have a migraine, is when they actually have migraines, to write down the time that it occurred, the severity, the frequency, and whether there are any triggering events for their migraine. And this is important, as I stated in bullet point number 2, to identify triggers. What can cause that? Has my migraine been initiated because I wasn't sleeping enough, or was it a stressful time, or was it the time of the month, or what exactly is happening? And by actually writing down a diary, people can start identify what is it that might be causing their migraines, and of course specific foods that they might have eaten, and so forth. Healthy lifestyle, which is also important, but specifically for migraine. Diet, if we know that there are some food additives that might be causing the migraines, regular exercise, and regular sleep patterns, because sometimes sleep deprivation can cause migraines, avoiding excessive caffeine and alcohol, minimizing changes in stress, because stress has been linked with the occurrence of migraine, and of course stress management techniques, which is something that is important, as I'm going to be talking about the complementary interventions. So with all that, and with the medication and the non-pharmacological management, the next question that I have is, what is the problem? Meaning, if we have all of that and all the medication, why is it that we need to have anything else but what we already have? So the answer is that many people that have migraines are still not responding, and they're not migraine free despite the current pharmacotherapy or the medications out there. Another thing is that the attack frequency is sometimes very hard to anticipate. So it sometimes is very difficult, even with a migraine diary, to identify what are specifically the triggers that initiated or exacerbated a migraine attack. So sometimes even that might not be helpful. Most importantly, stress has been shown to be a migraine trigger, or has been contributing to migraine chronification. Sometimes medications are not enough to manage stress. How do I manage stress effectively? But also, most importantly, the three bullet points that I want to talk about that I've learned when I started to work with migraine people, that those are very important and they're being very, very much neglected. And one of the things is that a lot of the people that are suffering from migraines are currently on disability and they feel isolated. A lot of the people with migraines, they can't participate in social events. They can't go and do what other people are doing, and that is very much a big problem for them that enables them to suffer from very much social isolation. They don't have a social network, and they very much feel alone. Now, when someone feels lonely and anxious or sad, that definitely cannot promote well-being, and that might be another factor that someone would amplify or experience worse migraines. Another important thing is that migraine is considered very, very stigmatized phenomenon. A lot of the people that don't suffer from migraines, when they hear about a person with migraine, they don't understand and they think it can be resolved with a glass of water or going out and taking a breath of fresh air, which a lot of the people that are actually suffering from migraines feel as if they're misunderstood, which again is very much important for their own sense of well-being. So with all that, I would like to go and talk about the complementary interventions that I decided to talk about today, which mainly is hypnosis and biofeedback. And I'd like to start with hypnosis. Hypnosis, as a lot of people might think, is not a state of sleep, even though the first term hypnosis is derived from the term hypnos. It's after the Greek word, and the word hypnos actually means sleep. But the fact is that hypnosis is not a state of sleep. Actually, hypnosis is the opposite. Well, maybe not the opposite, but it's definitely not a state when someone is sleeping. And the reason I'm saying that, because a lot of the people who come to me for hypnotic intervention, they assume that they're gonna come and they're just gonna go to sleep and they're gonna wake up and everything is gonna be okay. But hypnosis is not sleep. It's a state that a person is actually very, very, very focused and very aware of what is happening. It's specifically a dynamic and natural state of very deep relaxation when a person is very focused on a specific stimuli with the exclusion of other irrelevant stimuli. What I want to emphasize about that is that hypnosis is actually a natural state that every person goes in and out during normal day life. So for example, if I go inside my car and I drive home or to work or someplace, and then I get to where I wanted to go, but I don't remember driving, or I know that I drove, but I don't remember how I got there. Maybe because I was very focused on something or very absorbed in something. That's a state of hypnosis. Or if I'm watching a movie and the movie is so interesting and so fascinating, but it was 3 hours long, and for me it seems as if only half hour has passed. That's a state of hypnosis. Or if someone sits and reads a book and I call their name once and twice and 3 times, and they can't hear me because they're so focused on the book. That's hypnosis. It's a state of very, very focused attention when the stimuli is being very much focused on to the exclusion of other irrelevant stimuli. The use of that natural state for therapeutic purposes is termed hypnotherapy. Now, another important thing is that in hypnosis, the critical factor of the individual is bypassed so that hypnotic suggestion could bypass the critical factor of the conscious mind and work on the subconscious mind for the purposes of healing and well-being. And again, as I mentioned, the utilization of this natural state of being and that phenomena is hypnotherapy. Now, importantly enough, because each and every time when I talk about hypnosis, I think most of the people that I talk about, they come with a lot of misconceptions. The reason is because we all hear about the Las Vegas shows and people going on the stage, and it seems as if they're being made to do silly things like quack like a duck or say some silly things, and it seems as if the mighty hypnotist is doing something and the poor individual just doesn't have any control over it and is just doing some silly thing that the hypnotist is telling them. So that led to a lot of misconception about hypnosis that I wanted to cover today. The first thing that usually I'm hearing when I work with people using hypnosis is, I'm afraid I will lose control and will be forced to do things I don't want to do. And that's again part of the misconception of lack of control. When people think, oh, I'm going to go to this hypnotist and he's going to do all sorts of things and I don't know what he's going to do and so forth. Nothing can be further from the truth. In fact, hypnotists know that every hypnotherapy or every hypnosis is self-hypnosis, meaning that I can't initiate anybody else to do something if they don't want to do it, meaning there needs to be a voluntary participation in the process. If someone resists, there is nothing that I can do. So hypnosis is not a state of losing control. On the contrary, in a state of hypnosis, a person knows what is happening. It is just a state of very focused attention. Second misconception is hypnosis is a state of sleep or loss of consciousness. And again, even though the term hypnosis came from hypnos, Greek for sleep, hypnosis is not a state of sleep. In fact, if a person, and that could happen because hypnosis is very much a deep state of relaxation in the clinical setting, if someone falls asleep during a hypnotic process, pretty much hypnosis is done, meaning that hypnosis is not a state of sleep, it is a state where someone is voluntarily participating in the process of hypnosis. Another thing, which is again, I'm hearing a lot from people who are mainly very high educated and they think that only gullible or weak-minded people can be hypnotized. And the fact is that research indicates that the opposite is true. The only people that actually cannot be hypnotized are people with very, very low IQ, with severe retardation, or those people that have no sense of reality. And in fact, the higher the intelligence, the more hypnotizable a person can be, although there are highly intelligent people that cannot be hypnotized, of course. But hypnosis has nothing to do with being gullible. It is a voluntary state of that the person wants to participate. And in fact, if a person have a high IQ, they're able to visualize or think creatively and think in an abstractive terms, that is actually in favor of the hypnosis process. So hypnosis to work, it definitely doesn't mean that a person is gullible, and it definitely doesn't mean that only weak-minded people can be hypnotized. The opposite is, in fact, the true. Another thing is, I'm afraid of revealing my deep secrets under hypnosis. Again, this is connected with a sense of loss of control. Research has indicated that under hypnosis, if a person does not want to do or participate, they're not going to participate. The hypnotist cannot force or cannot make someone do something that is not in line with their value system. If I go too deep into hypnotic trance, I might never come out of it. Again, this is another misconception. If a person goes deep, then what could happen is that they're just gonna fall asleep, and they're gonna wake up either when I'm waking them up or when they're gonna wake up naturally. But hypnosis is not a state that you get stuck in. I'm afraid the hypnotist will force hypnosis on me. Again, it's another misconception of the fact that the mighty hypnotist can do something that I don't want to. And again, every hypnosis is self-hypnosis. A person cannot be hypnotized if they don't allow themselves to participate in hypnosis. The hypnotist can make me do illegal things, and again, a person cannot be made to do stuff against their value system, and even the mighty hypnotist cannot do that. But the last point, which is false memory, that is actually a real phenomena that I wanted to describe in here, because this is one of the danger of hypnosis, and this is something that is very important to cover, because as I mentioned, hypnosis is a state where the critical factor is being bypassed and suggestions are passing the conscious mind to go into the subconscious. In that state, if a hypnotist is biased toward a certain event that might have happened to the client, instilling false memories that never happened is possible under hypnosis. The reason I'm saying that is because if there would be an interest of any of the people that are listening to this presentation, it is very important to find a qualified hypnotist who has been well trained, that to know that first of all this phenomena exists, and to make sure that the client does not fall into the category of false memories. What does someone do when they actually come to a hypnotherapy intervention? So the first thing, at least that I do, is teaching self-hypnosis. As I mentioned, every hypnosis is self-hypnosis. The idea or the capability to teach a person to use suggestions on themselves to create a favorable state of mind, emotional state of mind, or physical state of mind is a process to be learned. A person first needs to learn to relax themselves enough to get to a state that they're actually suggestible to hypnotic suggestion, and use a specific language to initiate a favorable response, whether that's increased relaxation, warming of their hands, warming of their body, pain reduction, or whatever that might be. Self-hypnosis is something that is learned and is a part of training under the umbrella of hypnotherapy. Another intervention is, I call it symptom removal, which is pretty much initiating first a relaxation state. The reason is because every hypnosis is a relaxed and focused state of mind. So in order for suggestions to be accepted, first of all, the individual needs to be deeply relaxed, and then using suggestions to change presenting symptoms. This is something that is done in a hypnosis session. And this, I call it symptom removal, because these are suggestions that are specifically tailored for the problem, whether it might be reducing pain, increasing well-being, increasing confidence, stop smoking, or any other reason or any other problem that has been presented in the therapy room. And there are all sorts of ways that this can be done, using suggestion therapy or using guided imagery. If someone has a very vivid imagination, have a vivid ability to image, so you can use imagery as a way to conduct hypnosis session, or using metaphor work. For example, I work with people that came and they described their migraine as a very, very tight black rim across their head, or that they feel that someone is actually pushing their head from both sides. These are all metaphors that can be used under the hypnosis session to produce favorable outcomes. The third part of a hypnotherapy intervention, I call it addressing the cause, and this is predominantly identifying an initial sensitizing event that might have contributed or caused the presenting problem. This is usually termed age regression. I don't do that with a lot of people, but the people who are interested and can't engage in that form of intervention, this is another intervention that is under the umbrella of hypnotherapy. In that case, a person is, after deep relaxation, is being led by the hypnotist. It's be guided to go backward in time to a specific event where the event is relived, but the event is also changed based on the client's current understanding, knowledge, and experience, and therefore beliefs, ideas, or anything that happened in the past that might still be in the subconscious mind can be relieved, and the event can be desensitized or worked with for the benefit of the individual. Again, under this umbrella, this is why I talked about false memories. There is a lot of danger with people who are not trained or not well trained in hypnotherapy to cause a symptom of false memories and instilling memories that have never happened. This is why when engaging in age regression, it's very important to find someone who is qualified and well trained to do that kind of intervention. So this is Headache School. Is hypnosis or hypnotherapy work, does it actually help for migraine? And the answer is that, and I'm not going to go through all the bullet points, but the answer is that there has been research to indicate that hypnotic intervention, symptom removal, or training and teaching people how to reduce stress, how to reduce pain, has been shown to be beneficial compared to a control group. So that leads me to assume that there is a lot of benefit for the use of hypnosis or hypnotherapy for pain in general, but for migraine in particular. And everything I wrote in this slide is specific research that has been conducted using different forms of hypnotherapy for migraine, and all of those have shown that hypnosis has been effective. So that was the hypnotherapy part, and now I want to talk a little bit about biofeedback. What is biofeedback, and what is it that I talk about biofeedback after talking about hypnotherapy? And the reason is that as I'm going to talk about biofeedback, to me biofeedback goes hand in hand with teaching a person some form of self-relaxation techniques, self-hypnosis, or some form of self-regulation techniques, because biofeedback in itself is a modality that helps an individual better self-regulate. But let's talk a little bit more about what is biofeedback. Biofeedback is a branch of what we call applied psychophysiology. Applied psychophysiology uses the knowledge and the interrelationship between the mind and our thoughts and the body. So the idea is that to increase awareness to what is happening in our body. When we talk about biofeedback, biofeedback is the act of showing an individual in real time what is happening in their body, in their physiology, in real time, so they will know what is happening right now and what do they need to do in order to change their physiology. As I'm going to explain about the modality in the next slides, but the idea is that for the individual to increase the awareness of what is happening in their body and what are the processes, the cognitive processes that they need to do in order to change their bodily functions. So in the next slide, this is just an example when we look at biofeedback training. When we look at this individual that is lying in a chair and he has all these things and all these gizmos in him, the idea is that everything that has happened to us in our body, all the physiological parameters can be measured. But in order for them to be measured, I need to have some sort of ways to amplify the signal. So usually in biofeedback, I connect the individual to different electrodes or different components that enables me to observe the specific physiological parameter. After I'm connecting the individual, the signal is being displayed on a computer screen so that both me as the facilitator and the individual can look at the physiological measurement. Now, what are the physiological measurements that are being done in biofeedback? The first one is muscle tension. For muscle tension, I'm using specific electrodes on specific muscles of choice that I identified with the client to be problematic, maybe more underworked or overworked. And in those instances, when I'm connecting an electrode on a specific muscle, the individual can look on the screen to see when the muscles are tensing up or relaxing. So if someone, for example, has tension headaches, and I notice that they're really tensing their shoulders, in a lot of the cases, they're not even aware that without any reason, just by sitting down, they're tensing their shoulders. So if I'm taking those electrodes and putting them on their trapezius muscle or on their shoulders, and I'm able to show an individual on the computer to see, hey, you're just sitting, I haven't told you anything, but you're sitting and your muscles are tensed. Even if it might seem as if their muscles are relaxed, actually the biofeedback equipment indicates that their muscles are tensed, and the individual is not aware of that. Slowly, by recognizing how does that feel when the muscle is tense, getting the relaxation exercises I pointed out in the hypnotherapy part, and learning to relax and giving suggestions for relaxation of those muscles. Just as an example, a person could learn to better relax those muscles that might be contributing to their pain. So that's just an example on muscle tension. Another thing is respiration, learning correct breathing patterns. And I think from all the people that I've worked up to this point using biofeedback, I would dare to say that the majority of people I work with, none of them actually knew how to breathe. We live in a modern society. We live in a modern world. We live in a stressful world. We overbreathe. We breathe very quickly. We breathe very shallowly, very fast, and just from our chest. Learning proper respiratory techniques can very much influence anxiety disorder. For example, if I'm overbreathing, I'm pretty much shifting the balance of my blood gas levels that might contribute, for example, to a state of anxiety. That's just an example. Another modality that is taught in biofeedback is called heart rate variability. And even though just on heart rate variability I can have a whole hour just on that, but I'll just briefly say that heart rate variability in the last 30 years have been shown to be as a very, very important and very well-trained phenomena. What I mean by that, our heart is not a metronome. It does not beat at regular intervals. If we need to run, then our heart speeds up. If we're relaxed, our heart slows down. Each and every time we inhale, our heart beats a little faster. When we exhale, our heart beats a little slower. That's a that's a term called respiratory sinus arrhythmia. Heart rate variability is pretty much the ability to maximize the increase in heart rate and the decrease in heart rate. What do I mean by that? It means that by training a person in heart rate variability, because the heart is a muscle, we're training them to maximize the fluctuations of the heart from maximum maximum very fast contraction to very slow contraction. And it makes sense because it's like a muscle, and the more flexible a muscle is, the better the muscle is and the better the well-being of the individual. So in heart rate variability, the important is that it has been shown in research that the better the variability of the heart, meaning with individuals that they have the higher variable, the higher range between when the heart beats fastest to when the heart beats slowest, these are usually healthier people. The more this range diminishes, the more the other problem has been linked with that phenomenon. Training in heart rate variability is something that is done using biofeedback, and the training itself consists of a very specific type of respiration called resonant breathing. And with that in mind, when someone learns the correct frequency and anatomy of the breathing, they could maximize their heart rate variability. So that's a very important modality under the umbrella of biofeedback. Skin temperature. This is one of the hallmarks for the treatment of migraine. The reason is because in the 1970s, a person named Elmer Green, he was the first person to actually identify that when he was able to teach a person to increase their peripheral skin temperature, the result was that that person was suffering from migraine, and her migraine was reduced very, very significantly. The mechanism of that is a completely different lecture, but teaching a person to change skin temperature, to increase skin temperature, although decreased skin temperature is also a trained phenomena. People might think that changing skin temperature is impossible. Well, it is possible. It is an autonomic phenomena, but you can train a person to increase their skin temperature. Increasing skin temperature has been shown to promote migraine well-being. And the last but not least, galvanic skin response, which is a measure of arousal or excitability. This is to me a measure of sympathetic activity. So if someone is very, very anxious or very stressed, there's a very good measure for them and for me to indicate whether they're actually relaxed or not. And a lot of the people that engage in meditation or hypnosis or yoga, and they feel, oh, I've been meditating for years now, I've done that each and every day, and I think that it caused me to be relaxed, and then I'm measuring galvanic skin response and I'm asking them to meditate, and I'm seeing that, yeah, while they might be meditating, they're still not really relaxed, they're still aroused. So having them identify that they're actually not relaxed, even though they might think they are, correct that, and actually engage in a state of relaxation is something that is important. This is the claim of fame of biofeedback, to help a person actually identify in real time what is happening in their body so that they will be able to identify and self-regulate themselves. The idea behind biofeedback is that once a person learns to identify how that feels when they're stressed, or when they're anxious, or when their muscles are tensed, or when their hands are cold or warm, any of those modalities, when they learn to associate the felt sensation with what is actually being measured, they learn how to control it, and they can do that on their own without using any equipment. The biofeedback is just a learning process. So this is pretty much for biofeedback. Now, can biofeedback actually help with migraines? Well, research indicates that it does. And among the modalities practiced in biofeedback for migraine and tension-type headaches, everything that I've discussed about, but predominantly skin temperature, heart rate variability, and blood volume pulse feedback, which is again a measure that is used for heart rate variability, has been mainly used for treating migraines. And up to this point, biofeedback is considered efficacious for the treatment of migraine and for the treatment of tension-type headaches. So that is the migraine portion, and we've talked about the hypnosis portion. Last but not least, I want to talk about another thing that we have here at the University of Utah, and we call it the Healthy Mind Group. And the title that we have in the group is "You Can't Stop the Waves, but You Can Learn to Surf." I did not make that up. This is by Jon Kabat-Zinn, that he's the founder of mindfulness, but we adopted that for the purpose of Healthy Mind Group, because the reason is that even though a person not be able to stop their migraines, they can still learn techniques that have been shown useful to take with them and actually engage in life. And so just a little bit about the program rationale. We're designing the program so that we'll be able to give people specific tools for their individual use to better cope with not just the migraine, not just the pain, but all the associated symptoms, the anxiety, the depression, and so forth. The main thing is that even though it's a psychoeducational intervention, we build the program so that we're giving people specific tools that they can use starting day one and use them throughout their day, throughout their week, and pretty much equip them with more and more tools so they'll be able to use them for their own benefit. And instead of fear, uncertainty, pain, feeling out of control, and so forth, we're teaching people to develop peace of mind and some pleasure in the daily living. That's what we mean by we say we might not stop the wave, but you can learn to surf. And how do we do that? By teaching specific interventions, specific tools for daily self-management of mind-body techniques and understanding the emotional components of pain. With that in mind, we're also teaching to apply those different skill sets to their daily lives so that these skill sets can pretty much become a second nature. Some of the things that we are doing, first of all, the program is 10 weeks, 2 hours each and every time. And what we're teaching in the program is specific skill sets, starting with relaxation exercises, different forms of relaxation exercises, because one relaxation exercise can work for one person, but not for another. So we're very much variable in the type of relaxation exercise that we're giving, including muscle relaxation, breathing exercises, visualization exercises, and so forth. Specific techniques for pain reduction, emotional aspects of pain, and learning pain desensitization, perception and the language of the mind, working with how we perceive reality and how we perceive pain and how to work with that, how to work with the negative self-talk that everybody has, because especially people that suffering from chronic condition, they might think, oh, I'll never get out of it, it will never go away, and all this negative self-talk has a very important impact on a person's daily living. So how to work with those negative self-talk. Learning to forgive myself, learning to forgive others, it's something that is very important, and gratitude, which is again something that once we cultivate has been shown to promote a lot of well-being. So this is pretty much what is covered in the Healthy Mind Group. If someone is listening and they want to participate, what is required is a phone interview with us, the organizer, to fill the forms, and of course to come to the session and be an active participant. And what is most important that we want to emphasize in those sessions is that we don't just give the tools, we expect people to use them and actually enjoy the benefit of these tools. So up to this point, I've talked about migraine, complementary interventions, the use of hypnosis for migraine, the use of biofeedback, and last but not least, our program here at the university, which is called the Healthy Mind Group. And in the Healthy Mind Group, we are incorporating a lot, but Also self-hypnosis and some biofeedback techniques, but also other forms of mind-body interventions. That pretty much concludes my talk. I'm very happy to be here. And if there's any questions, I would assume that my information is displayed on the website, and I'll be more than happy to answer questions in the future. Thank you again, and have a good evening.